So you're getting close to that retirement finish line. And the word Medicare is probably popping up a lot. It's supposed to be a safety net, right? But honestly, a few simple mix-ups can lead to penalties that stick with you for life. We're going to cut right through all that noise and lay out the 5 critical Medicare rules you absolutely have to get right.
You know, it's a common thought, right? You hit 65 and boom, Medicare just kind of happens. Like a little card just magically shows up in your mailbox and you're good to go. But for millions of us, it is just not that simple. And assuming it is, well, that can be a really costly mistake.
And when I say costly, I'm not kidding. Believing some of these common myths can literally lock you into paying extra financial penalties for the rest of your life. So getting this right from the very start is so important. Let's break down exactly what you need to know so that doesn't happen to you.
Okay, so let's dive right into rule number 1. This one tackles the biggest assumption of them all, that when you turn 65, enrollment is automatic for everybody. You know, this is where a ton of people get tripped up. So the big question is, who gets it automatically and who has to actually do something?
It actually boils down to something really simple. If you've already started collecting your Social Security checks before you turn 65, you're all set, you will be enrolled automatically. But, and this is a big but, for everyone else, and that includes a lot of people who are waiting to claim Social Security, the ball is entirely in your court. The responsibility is on you to actively sign up.
All right, on to rule number 2. And this one is a classic mythbuster. A lot of people think Medicare is strictly a 65 and older club. Turns out that's not the whole story. There are definitely ways you can get this coverage long before your 65th birthday.
So how do you get in early? Well, the main path is through Social Security Disability Insurance, or SSDI. The rule is pretty straightforward. Once you've been receiving those disability payments for 2 full years, that's 24 months, you automatically become eligible for Medicare. Your age doesn't even matter at that point.
Now, that 24-month waiting period, it isn't set in stone for everyone. For some really severe health conditions, they just waive it completely. For instance, if you have ALS, your Medicare coverage starts the very same month your disability benefits kick in. And for folks with end-stage renal disease, you can qualify at any age.
This brings us right to rule number 3. And listen, if you're one of those people who has to sign up on your own, you really need to lean in for this one. This might just be the most important rule of them all. We're talking about your 7-month enrollment clock. And I mean it when I say the timing here is absolutely everything.
And here's why the stakes are just so high. Missing this deadline isn't like forgetting to pay a bill, where you just get a one-time late fee. Oh no, this is way more serious. The penalty for being late gets tacked on to your monthly premium forever. It's a mistake that literally costs you money every single month for the rest of your life.
So let's get this timeline burned into your brain, okay? Just picture your 65th birthday month right there in the middle. The clock starts ticking 3 months before that month, and it stops ticking 3 months after it. That's it. That 7-month window is your one and only shot, your golden ticket to get enrolled without facing those penalties. Phew, okay. So, you did it. You enrolled on time, you're all set, 100% covered for anything and everything, right? Well, not so fast. And that brings us to rule number 4, understanding the 80% coverage gap. You really have to get what Medicare does, and maybe more importantly, what it doesn't do.
Here's the hard truth. Original Medicare was built to cover about 80% of your major medical costs. Now, don't get me wrong, that is a massive help, but it leaves a pretty significant 20% gap. And that part, that's on you.
And that 20% slice of the pie, that's all yours. Now, 20% might not sound like a huge number, but let's put it into perspective. 20% of a $100,000 hospital stay is $20,000 out of your pocket. For a serious health issue, that gap isn't just a gap, it's a chasm. So what kind of stuff falls into that 20%? Well, you've got your usual suspects, deductibles, copays for doctor visits, and here's a big one, most prescription drugs. But honestly, the biggest shocker for most people is that original Medicare does not cover long-term care. We're talking nursing homes, in-home health aides, none of that stuff is covered. Okay, last but certainly not least, rule number 5. This one's for all the people out there who are planning to work past age 65, which, let's be honest, is a lot of us these days. You might be able to delay signing up for Medicare, but, and this is a huge but, you have to do it exactly by the book to avoid those nasty penalties we keep talking about.
So how do you know if you can safely hit pause on your Medicare Part B? It really comes down to a simple 3-point checklist.
Question 1. Are you covered by a health plan from the company you're currently working for? Question 2. Does that company have 20 or more employees? And question 3, is it a real employer plan, not something like COBRA or a retiree plan, because those don't count. You need a yes to all 3 of those, no exceptions.
And let me be crystal clear on this. I really can't say it enough. If you put off signing up for Part B and you don't check off every single one of those boxes, you are going to get hit with the exact same permanent, lifelong penalties as if you just missed your sign-up window entirely.
So when you boil it all down, what's the big takeaway here? I think the best way to think about it is this. Medicare is the foundation of your healthcare house in retirement. It's solid. It's essential. You absolutely can't build without it. But it is not the whole house. It is not a complete all-in-one solution that's going to cover every single health cost you could possibly face.
Look, getting these 5 rules straight really puts you in the driver's seat. It's going to help you dodge some permanent and really expensive mistakes. But it also shines a spotlight on a much bigger question. Now that you know the reality of the 20% gap, the drug costs, and the long-term care situation, take a hard look at your retirement savings. Is that plan truly ready to handle the real cost of healthcare? Because answering that question, that's the crucial next step.